Hello everyone, I am Gayatri, faculty at IDEAS, Office of Interdisciplinary Studies at OP Jindal Global University. Today we are going to have a very interesting conversation, a serious conversation on public action and social accountability. Many a times we see that or we look at state welfare as a sense of like a benevolence of the state, overlooking the public action and the processes involved in it in getting the state welfare programs in place. So today we look at these questions primarily from the angle of health and particularly looking at the ICDS program. And today we have Dr. Preeti Krishnan, Associate Professor at Jindal Law School, and who has done extensive work in the area, and her field is also Tamil Nadu. And we are very glad to have you today with us to talk about this. So let's start with the basic question here. How do you look at public action and social accountability? And how do you think both of this is connected, particularly when we look at state welfare programs, etc.?
Thank you, Gayatri. Yeah, I think there is a tendency when we think about welfare to consider citizens as these, passive beneficiaries of the state, and the state is just providing it and so on. But that is not how we see in life, right? Unless a very vibrant citizen community is holding the state accountable, even to hold the welfare state to make it work is very hard. So public action is a very important part of holding the state accountable. And a lot of my work, I draw on Amartya Sen's entitlement framework. Say specifically, let's talk about hunger. So currently in India, for example, we don't have an issue of production. We do produce food that is there for all of our citizens, and yet our citizens are, many of them are hungry, our children are malnourished, etc. And Amartya Sen argues that we should follow an entitlement framework, that people and citizens should feel, or the state should consider food and the distribution of food as an entitlement of citizens. And there are these social audits that John Race, etc. has done, which shows that in states where there is the very vibrant social movement that can make those claims from the state also works better. And I would say that one of the legislations, like the right to food legislation that has come about, is to make food as an entitlement. Although one can also criticize that legislation, that it wasn't as progressive as even some states were. But the point is that we did see some laws that were put in place to ensure that people can hold the state accountable to providing them these welfare systems. Yeah.
Well, that's a wonderful way of putting it. So maybe how are you coming to ICDS with this? How are you connecting this with ICDS? Yeah. It kind of looks like a program that was there forever, and like you don't really see public action coming into picture when I look at ICDS. Also drawing from your work.
Sure. Yeah. It's true, it's called Integrated Child Development Services. But I will tell you that it isn't only about children, although children are a big part of ICDS. So first, to explain what ICDS does is that it works through these neighborhood childcare centers called Anganwadis. And through them, in that neighborhood, children up to the age of 6 are entitled to food, education, and supplementary nutrition, as well as pregnant and lactating mothers are also entitled to certain benefits in that sense, right? Like food and nutrition, etc. And all this is put in place through Anganwadi workers who are very close to the homes that exist in that neighborhood, in those villages, etc. So usually an Anganwadi has 2 people, the Anganwadi worker who is also the teacher, and a helper who does the cooking, cleaning, etc. Now, I would like to argue that even though the this is how we generally explain, like if you go to the government website, this is how it is. But I want to see the Anganwadi as a much more beautiful place where you see a lot of resistance, public accountability, etc. So I think the Anganwadi can be seen in 3 ways. One, as one that offers food and nutrition and education to children. The other as where it is a space that redistributes care work from the family to the state, which is very, very important to mothers. And third, often forgotten, it is a workplace for the Anganwadi workers themselves. And all of these spaces will work in its most beautiful way when all of these stakeholders start holding the state accountable.
Yes, yes, absolutely. So, if we have to, like part of it you already mentioned, but if you want to look at health,
Yeah,
and say rural health,
yeah.
how much of it, I mean, what is probably this entire system
Absolutely.
doing with respect to rural health? And also, I would like to hear about your own experiences from Tamil Nadu, where you have also done very extensive field work on. Yeah.
I think, so let me start with Tamil Nadu itself, that, Tamil Nadu has a long history of food entitlement policies, whether it is that even the public distribution, the grain distribution system was more universal than it was targeted as it is in the Right to Food Act, which means that everybody, irrespective of their poverty levels, had access to subsidized grains if they so needed, and that made a difference. Or the very fact that the midday meal was institutionalized first in Tamil Nadu. All of that demonstrates that the state policies can be put in place where the importance to food as a citizen's right is put in place, but I think coming to ICDS itself, the Tamil Nadu government also beyond the ICDS also had a program called Tamil Nadu Nutritional Program, Integrated Nutrition Program, where they wanted to provide supplementary nutrition. It was a World Bank funded project to children. So when I speak of rural health, I think nutrition also plays an important part. Food and nutrition plays an important part in ensuring that a future generation is healthy. So access to food and entitlement to food becomes very important in that sense. So those were some of the policies that were put in place. And the Anganwadi in specific plays a huge role in that. So the TINIP, the Tamil Nadu Integrated Nutrition Project, required something called as growth monitoring. So are our children growing according to their age? So even today, the National Family Health Survey will keep track of underweight or stuntedness, and so on. Where are we getting all this data? How does the government keep track of children's growth? It is through these Anganwadi workers. Besides sitting in and teaching at the Anganwadi, they go and do all of these house visits. Every time a child is born, the Anganwadi worker knows about it, goes there, weighs the child, ensures that, checks whether the child is growing according to their age, and if not, counsels the parents, gives them this supplementary nutrition, which is like a little bit, it's like a dough, with a multigrain dough. And that is how we, improve the nutritional level of our people. And also something like polio eradication. So today we are very proud that we have eradicated polio. How did we do it? If it was not for the Anganwadi workers and the ASHA workers, we would not be a country free of polio. Because again, they are the ones closest to each of these homes and ensuring that vaccination happens and so on. Now, the government, again, the Tamil Nadu government does, and I think has certain schemes in place where if you do vaccinations, you will get certain amount. So there's incentives like that. But they do all this through the Anganwadi worker. So the Anganwadi worker is a very important role in ensuring that we are, as a country, are healthy and continue to be healthy.
Right. Also, when we talk about health, mostly we have just hospitals in mind, and like doctors and sometimes nurses also come into picture. And you don't see like a health infrastructure, a community health infrastructure beyond that, like in a vision of it. And the second part is, something which you mentioned earlier, which also when you explain the work, the extent of work the Anganwadi workers do, and and care work.
Yes.
And now in the global development discourses also, we keep on hearing about care work again and again. But there is something very interesting about how the care work of Anganwadi workers here, when it becomes a state program, but yet not recognized as workers.
Yes.
Do you want to share a little bit more about that?
Yeah. So here we're talking about Anganwadi workers as workers, right? So there is a tendency always to not recognize caring as work, right? Both whether it happens at home or whether it happens in a paid setting like this, that they might be paid less. So in the case of Anganwadi workers, see, now we are offering mothers to say that, okay, you will have, you know, the Anganwadi that will be open at 9 a.m. in the morning till 3 p.m. We will keep track of we will, you know, take care of your children who come here. Then after that, I just mentioned, she has to go to every home and, you know, do house visits, etc. So the expectation is that the Anganwadi worker will work from 9 to say 3, 4 or even more. But then in most, and I think in all states in India, they are considered to be either honorary workers or voluntary workers, which means they do not get all the benefits of a full-time worker. So I think the Anganwadi workers, their own resistance has a huge role, and so they play a big part in actually ensuring that the state gives the due credence to the care work that they do. And all of that, so they go on, you know, even recently here in Haryana, there was a long strike that the Anganwadi workers went to. In Tamil Nadu also, they all engage in lots of protests and strikes to ask for wages, for pension, for maternity leave, etc. While it might seem like it is just a strike for Anganwadi workers, I see it as a strike for valuing care work, which is an important principle that we as a society itself should consider. So that is one. The other part of it is that we didn't speak about caste until now, and I think it's important to see caste also playing a role in care work, especially in the context of food, right? Even today in some of my work I also see that there are caste divisions in society to the point that people might not have food prepared by Dalit cooks, right? Dalit Anganwadi workers. So those kinds of issues exist. But Dalit Anganwadi workers have challenged caste as well. So one of the reasons why I went to Tamil Nadu to do this was because I came across a case, D. Podumalli versus District Collector in Thiruvarur. That's a case. And the case was about people asking the Tamil Nadu government to provide affirmative action on the basis of caste, which is provided in other government jobs. So why not this? The Tamil Nadu government's answer was taking the honorary worker point, that this is not a full-time job. So why would we do affirmative action in the same way? But they challenged it, and the decision was favorable to Anganwadi workers. And surprisingly, if you've seen the movie Jai Bhim, the character there is the judge, Justice Chandru, who actually wrote this judgment. And he argues, and his reasoning for why he thinks there must be affirmative action is because of the divisions in society. And it makes a huge difference to have a Dalit woman as perhaps the first teacher that a child encounters in their life. So it's not to see Dalit women as only victims, etc., but to people who are knowledgeable, who are your teachers, who care for you, and so on. So that, and I think, so now Tamil Nadu has affirmative action in recruiting Anganwadi workers. And I think that has played a role at times that, of course, some villages or some communities will still be biased against the Dalit teacher or the cook. But in other places, those those divisions start slowly moving away. So the very fact that they went to court has made a huge difference in society. It might be slow, but this was an act of resistance, which makes our society a little bit better in that sense.
Yeah, absolutely. And like now I'm able to also connect all of this, where we started with the public action.
Yeah.
Becoming like a social accountability generated through this, and then connecting it to programs. So many a times, how I look at it is like when Anganwadi workers are doing this, it's actually a public action process that's happening, which is connected to recognizing care, rural community health, and many other aspects also, so it's also a site of struggle.
Yes, absolutely.
Yeah.
In many different ways, right? Whether it's caste, whether it's gender, whether it's care work, all of that. So we shouldn't see the Anganwadi as and it's women are, and they were not passive there, right? There is holding the state accountable comes very alive in the context of the Anganwadi. And if I may speak about mothers as well, this is the other, you asked about care work. So I did want to speak about, for mothers, what does it matter, right? Again, people might see it as for children, and it is for children. But I also see it as a place where you can redistribute care work from the family to the state. And I'll tell you why it's important. Especially, so for this I draw from the social reproduction theory. So if you consider capitalism, right, how does a worker go to work? And if they have to be present at the workplace in order to create profit, they need to be fed, they need to have a place to sleep, they need to be healthy. And so there's a lot of care work that the capitalist system actually depends on in order to ensure that the worker is healthy enough to go work for them. And oftentimes capitalist systems do not value or give them any does not completely devalues the care work that enables the worker to go there. And so I think so oftentimes if you think about how do people do care work, you can think about it in the form of a care diamond. Either the family provides the care, so that so every worker, whether they have children or elderly, they need somebody to do that. And oftentimes in working class families, the care worker, the woman, is typically the care work is done by women. That they're both care workers as well as the worker, right? So it's a lot of stress and pressure on them. And so a lot of mostly families do the care work. For elite families, they may be able to access the market. So that is not affordable to everybody. And especially currently with increasing privatization, you will see that everybody cannot afford private care. And unfortunately, that is kind of happening in Tamil Nadu right now, where there is a move from the public system to the privatization of nursery schools. So a lot of families are even getting loans when to send their kids to nursery and so on. There is the family, there is the state, and there is also there is the state itself, right? The market and the state.
Yeah.
Which is why I think state providing care is so important. If you cannot afford market and the family is so, when I say family, it's usually women, are pressured to give all the care work, the provision of a public system of care makes a huge difference to mothers. And I'm not only talking about, elite women who can then find, care work, distribute care to the state and then go to work. Because oftentimes what happens is, because of the lack of child care, that ends up women, they do not participate in the labor force. That might happen in some cases. Among Dalit and Adivasi women, they do have to work. But for them also, a state-provided care matters. Because otherwise, they have to take their children to their place of work. They're constantly worried if their children are safe. And every time they spoke to me that, I am just relieved that my child has something to eat and is taken care of. That attention that they have to often give is redistribution of work that would have often fallen on the women to now the state. And I think that's a huge benefit. And this all definitely came into the importance of the public system became very, very clear during times of COVID. We actually saw people moving from families moving from private schools to, the public systems because they were economically completely devastated. Now, if with increasing privatization we continue to weaken these public systems, what happens when there is a crisis like this? And I think during the pandemic we saw that in states and countries where there were very strong public systems, including health, they were able to better adapt and deal with this issue. Otherwise, even for a completely privatized healthcare system, people found it very, very difficult to deal with that aspect. So I think state-provided care, state-provided healthcare systems play a huge role in keeping our society healthy, and specifically in times of crisis. So we cannot weaken it.
Yeah. And I cannot agree more because my concern with the current care conversation is that the more you seek solutions from the market, the more exclusionary all this has become, and it actually misses the public action aspect of it.
Absolutely.
Yeah. So like and it's very, very problematic, like if that's where this trajectory is taking us to. And like some of the recent controversies also offer outsourcing domestic work and everything.
In urban companies.
So like to conclude, so when you look at studying development or like how much do you think you've been teaching also for you've studied in US and like taught there, you're teaching here. How much are we capturing all these in our development programs, beyond the GDP numbers or the indicators? How much of these conversations are becoming the conversations of development? And like, some thoughts on that as your concluding thoughts.
Sure. I do think that when we think about development, moving, and there is sometimes a tendency to think about development as only economic development and therefore giving emphasis on GDP. I think with the Millennium Development Goals and the Sustainable Development Goals, we try to move into a more holistic way of thinking about development. And but I still feel that numbers by itself doesn't always tell us we always tend to miss things. So the problem with GDP was that, right? That you have one number, but does that number tell us the story of the lives that are around us? And also to think about development as growth, especially at a time when we are going through a climate crisis, is also problematic. So we do need to think about development, and our pedagogy and our programs need to think about development from a very much more broader way beyond growth, but on even thinking about human development. How do we bring in various aspects of gender, caste, etc.? I've never even we do have scholars like Thorat and all discussing caste and development, but I think those intersections of gender, caste, etc. also need to come in a conversation on development. So that's my
Thank you so much, Preeti. It was just so insightful listening to you, and like we hope through these conversations, I mean, we also want to take it forward what development means also, and thank you so much for having this conversation with us, and hoping to have many of these conversations in the future also.
Thank you so much, Gayatri.